Good morning, ma'am. Good morning, classmate. Today, I will discuss about physiological of human sexual response. Ano nga ba ang physiological of human sexual response? Ito yung physical or emotional changes na nangyayari sa isang tao kapag ang isang tao ay participated sa anumang sexual activities. There are four phases of human sexual response. First, the first phase is excitement phase. The beginning of arousal. Arousal, ibig sabihin sa Tagalog ay nalilibugan. Excitement phase can last from a few minutes to several hours. Ano nga ba ang nangyayari dito? Increased heart rate, pagtaas ng heart rate, blood pressure, blood flow, flushing, or yung redness sa skin, swelling, pamamaga ng private part at breast, pagbilis ng paghinga, at pagtaas ng muscle tension. The second phase is plateau. The changes of the body continue. Kung ano yung nangyayari sa excitement phase, kung ano yung mga changes na nangyayari, dito sa plateau is continue lang siya. Pero mas lumalala lang yung mga changes na nangyayari. Next is sexual climax or orgasm. Orgasm ay nangyayari sa babae at sa lalaki. Sexual climax, ito yung tinatawag nating the peak of sexual cycle. Kung sa excitement phase, can last from a few minutes to several hours. Dito naman can last only a few seconds. Intense pleasure, rapid increase in pulse and blood pressure, and rhythmic muscle contraction in the pelvic. Dito, mas nagiging intense na yung mga changes na nangyayari. Dito na rin yung nilalabasan na yung mga lalaki ng semen or tinatawag natin ejaculation. After the sexual climax, resolution phase is the last stage that refers to the return to a normal or subnormal physiologic state. Ito yung mga changes na nangyayari sa exciting phase, plateau, and sexual climax na bumabalik sa dati, bumabalik sa normal, yung mga changes na nangyayari. Ang lalaki ay bumabalik agad sa normal unlike sa babae because female capable of multiple orgasm kesa sa lalaki.
Sexuality transmitted diseases. Sexuality transmitted infections or STIs, also known as sexuality transmitted diseases, STDs, or venereal diseases, VD, are diseases that are passed on from one person to another through sexual contact. The infection can be passed on through vaginal intercourse, oral sex, and anal sex. Some sexually transmitted infection can spread through the use of unsterilized drug needles from mother to baby during childbirth or breastfeeding and blood transfusion. Sexually transmitted infection has been around for thousands of years. So, the transmitted infection or infection spread through sexual contact including vaginal and oral, anal sex. Some STIs can also be transmitted through shared and needles from mother to child. During birth or breastfeeding and blood confusion, ang mga infection na nakukuha sa pakipagtalik ay umiiral sa loob ng libo-libong taon. Ang lugar ng ari ay nagbibigay ng mainit at mahalumigmig na kapaligiran sa perpekto para sa paglaki ng mga libodura or virus or bacteria. Ang mga microorganism na ito ay maaaring maipasa sa panahon ng pakipagtalik sa pamagitan ng direktang pakikipag-ugnayan ng balat o sa pamagitan ng mga likido sa katawan tulad ng tamod or vaginal secretion o dugo. Mas madaling maipasa ang mga sexual transmitted infection sa panahon ng pakipagtalik na walang proteksyon nang hindi gumagamit ng mga ligtas na options sa pakipagtalik tulad ng kondom, dental dams, or paglilinis ng mga laruan na sex. Sexually transmitted infection are more easily passed on during unprotected sex without using safer sex options, etc. Condoms, dams, sanitizing sex toys. Some infection can be passed on via sexual contact but are not classed as sexually transmitted infections. For instance, meningitis can be passed on via sexual contact, but usually people become infected for other reasons, so it is not classed as an STDs. At bagamat maipasa ang mga ilang mga infeksyon sa pamagitan ng makikipagtalik, hindi sila nakategorya bilang STI dahil karaniwang nakakuha ng mga tao ang infeksyon sa ibang mga paraan. Halimbawa na lang, ang meningitis ay maaring maipasa sa pamagitan ng pakipagtalik, ngunit mas karaniwan itong maipapasa sa ibang mga paraan kaya hindi ito itinuturing na STI. The World Health Organization estimates over 1 million new STI are acquired daily worldwide. Half of these new infections occur in people aged 15 to 14, with 1 in 4 sexually active adolescent females having an STD. This age group is at a higher risk than older adults through STIs. Rates among senior are increases. And the next topic is about sexual problems. Sexual problems are one of the most controversial issues around the world. Even way back in the early ages, this kind of problems has been existed. When someone is experiencing sexual problem, it can affect a person's ability to have a satisfying sexual experience. Kasi sexual problems has been defined as a difficulty in engaging in sexual activity. In other terms, sexual problems is also called as sexual dysfunction. This can happen depending on factors such as having an infection, hormonal imbalance, and diseases that will be further tackled by the next reporter. Sexual problems has 3 main areas. First, we have the physiological or physical problems, which refers as an issue that affect the physical functioning of the body. Sa madaling salita, the problems are often associated on how our body function, sa organs natin, at sa tissues natin, na mostly can cause an injury, illness, or genetic conditions. First, we have the first example, diseases like diabetes, kung saan our body no longer or did not produce enough insulin. This can affect the body to regulate enough blood sugar levels, leading to complication in various organs and tissues kasi nga ginapurulang ito yung blood sugar natin ng mataas, which can cause damage to the kidneys, nerves, and the eyes. Ganyan siya mag-impact sa body system natin, Second is we have the infection and inflammation. For example is when a girl is having a vaginal dryness, which was a common female dysfunction sa babae, where the vagina did not produce enough lubrication which can cause inflammation or infection sa private part ng babae kapag wala ito. Third is tumors like adrenal tumors. It is a cancer located on top of your kidneys. This can disturb hormone production. Kasi ang hormone is a chemical messenger that travels through the bloodstream, coordinating different function in the body, sa organs and sa tissues mo. This may lead to hormonal imbalance and so on kapag nagkaroon ka nito. Next is aging changes in vagina. Here, as a woman ages, their vagina changes. Particularly, this happens after their menopause, also called vagina atrophy. This condition involves thinning and drying of the vaginal lining due to the decreased estrogen levels, leading to symptoms like dryness, irritation, and pain during intercourse. Since estrogen are hormones of female sex, its role in reproduction is to help keep bones strong, affect moods, and support heart health. Last, heart problems like cardiovascular issues. This happens when an estrogen decreases, since estrogen support heart health. Now let's talk about the second categories of sexual problems. We have the psychological or mental problems. This involves mental health conditions that affect a person's mood, the way they think, and their behaviors. Due to the social pressure, negative attitudes such as harmful beliefs and thoughts, ignorance, and mistakes. Sometimes this can cause depression, anxiety, stress, and so on. Here are the example. First, we have the premature ejaculation. It happens when a man ejaculate or nag-release ng semen agad. This happen because of attention. Second is we have the erectile impotence, where a man is having a difficulty in getting an erection, which means a male was having a hard time getting hard, usually due to the mental stress in younger men or sa older people under the 40s na. Third is ejaculatory impotence, kung saan they are having trouble ejaculating during intercourse. This is often associated with fear and past traumas, although less common siya sa male. Next is we have the vaginismus. It is involuntary tightening of the vagina muscles, making intercourse painful or impossible. Usually this happens because of stress, or it can be fear. Now let's proceed to the last one. We have the social or societal problems. So here, this is an issue that have arisen from social or interpersonal factors that can affect the way we perceive something or how we are going to live our lives because of the social influence or the norms there. This includes challenging discrimination and mostly social isolation. Like for example sa intercourse, kapag yung babae is first time makipagtalik, they are expecting to bleed as a sign of being a virgin, which is actually a wrong beliefs. And that's all for the sexual problems. So, sumunod is Chandroid. Chandroid is a subchandre. It is a bacterial infection that results in painful sores on genital areas. It is caused by bacterium called Haemophilus ducreyi that spreads through sexual contact with the infected person. Common siya sa mga developing countries, particularly among commercial sex workers and certain low-income groups. In wealthier countries like United States, noong around 2015 may natalang 11 cases. Symptoms nito is first the initial stage. Within 1 to 2 weeks after infection, a small bump appear on the genital. Ang progression nito, the bump quickly turns into a painful ulcer or sore. So the size of ulcer is 1/8 of an inch hanggang 2 inch across. Ang appearance nito is yellowish gray material at its base. If the base is gray, it may bleed. So sa gender differences, women typically have multiple ulcers. Some men usually have just one ulcer and tend to experience milkier symptoms. So common location for ulcers: in men, the sores often appear on the back of the head of the penis or the coronal. So sa babae naman, the sore may appear on the labia minora. It is an inner fold of the vulva or the thin fold of skin at the back of the vulva. So it is important to know kasi chondroid increases the risk of contracting HIV and vice versa. It means if someone has HIV, they are also more likely to get chondroid. Pubic lice. Commonly known as a crabs, they are tiny insects that infest the hair in the public area. They are called crabs because they have crab-like claws and body shape that resemble crabs. Nagspread sila through sexual contact with an infected person, no? They can be found usually attached to the pubic hair. They can sometimes be found in other areas with courses, such as armpits, mustache and beard, eyelashes, and eyebrows. So, nagsusurvive sila by feeding on human blood.
Genital herpes, hepatitis B. And HIV and AIDS.
Genital herpes. Genital herpes. This study is caused by the herpes simplex virus or HSV. HSV is easily transmissible from human to human by direct contact. It is the virus that affects the skin, cervix, genitals, and some other parts of the body. Herpes is a long-term or chronic condition. Based on research, it was discovered in 1872. So there are two types of genital herpes. First, herpes simplex virus 1, and the second one is herpes simplex virus 2. So let's discuss the herpes simplex virus 1, which is also known as herpes type 1. This type 1 is more commonly transmitted from shared straws, utensils, kissing or drinks, and etc. Hi guys, let me remind all of you nga dapat maging safe and aware ta sa mga mga ginagamit kay basi ang naggamit pod is may sakit, lalo na nga ani nga type 1 nga genital herpes. Lalo sa mga mag-enter ta sa relationship kay we don't know nga atong partner is may sakit siya ngayong ani and pwede po siya makatakod sa tua. Also, in type 2, it occurs through vaginal, oral, and anal sex. It means guys, if mag-sex mo sa imong partner through inserting the penis, so pwede siya makatakod, oral or anal sex. So the difference of oral and anal sex, the oral sex, it is involved stimulation of the genitals or other erogenous zones using the mouth, lips, or tongue. So it means guys, if mag-kiss mo sa imong partner, so pwede siya makatakod, especially ang laway. It is liquid, diba? The anal sex also, it involves inserting the penis, fingers, or sex toys into the anus, which is the opening of the rectum. So, naingonan ako gayon na guys nga, pwede siya makatakod through inserting the penis, fingers, or sex toys. That's why let's keep aware sa mga ingani nga masakit kay dili lalim. The signs and symptoms associated with genital herpes. First, the blisters and ulceration on the cervix. Second, vaginal discharge. Third, pain on urinating. Fourth, the fever. Fifth, generally feeling unwell or malaise. Sixth, cold sores around the mouth. For type 1 HSV. Hepatitis B, it is sexually transmitted disease also. It is caused by the hepatitis B virus or the HBV. It is transmitted through contact with infected semen, blood, and some other body fluids. Further, they may infected by having unprotected sex, unsterilized syringe, drinking infected breast milk. So, if you're asking, pwede matakot ang baby, lalo na ka ng sanggol pa, may possible po, lalo na kung infected ang iyang gatas sa dede sa mama. This disease, it can lead to cancer. So, hepatitis B is a viral infection that attacks the liver and can cause acute and chronic disease. So, if maghina ang imong immune system, so pwede siya makalid sa cancer. So, based on research, ang pinaka-top 1 nga pinakadaghanong hepatitis B, which is China. It has 120 million people infected, or the 8.9 of the population. So as for now guys, is top 8 Philippines. But I prayed and hoping nga mula ta sa list sa mga ani, and praying for healthy sa kada isa. HIV and AIDS. HIV, it stands for Human Immunodeficiency Virus, is a virus that causes AIDS or acquired immune deficiency. HIV, it is the Human Immunodeficiency Virus. It is a virus, while the acquired immunodeficiency syndrome is an illness or disease. Ang HIV, ga-target siya sa white blood cells para maghina ang imo nga immune system. So, may tendency nga pwedeng magkaroon ng tuberculosis, infection, and some cancers. According to research, it is not spread by kisses, hugs, or sharing food, this disease. When a person has AIDS, their immune system is altered and they become much more vulnerable to infections and diseases. As the disease progresses, this susceptibility worsens. HIV exists in the body fluids of a person who has HIV, such as semen, blood, breast milk, and vaginal fluids. HIV can be transmitted through blood-to-blood contact, which may occur during sexual contact, vaginal, oral, or anal sex. Blood transfusions, breastfeeding, childbirth, and the sharing of infected needles.
Human papillomavirus, or HPV. Most people with an HPV infection have no symptoms. Human papillomavirus is a name for a group of viruses that affect the skin, as well as the moist membranes that line the body, such as the throat, cervix, anus, and mouth. There are over 100 types of HPV, of which about 40 can affect the genital areas. These types may also infect the mouth and throat. The ones that affect the genital area are known as genital human papillomavirus. So, for everyone who doesn't know what a HPV looks like on the skin, you can refer to the image on the right side of the screen. So HPV infections can lead to the abnormal growth and alteration of cells within the cervix, which significantly increases the risk of developing cancer of the cervix, genital warts, the most common STD in the major of developed nations.
The majority of infected individuals have no symptoms and are unaware. HPV is most commonly transmitted through vaginal or anal sex. However, oral sex and genital to genital contact without penetration are also avenues for transmission. Infected people with no signs and symptoms can infect others. A pregnant mother who has HPV can transmit the virus to her baby during childbirth. Although this is very rare, the best protection from HPV infections is to be vaccinated.
The next one is the trichomoniasis. So, trichomoniasis is commonly sexually transmitted disease that can affect both males and females. However, women are more likely to experience symptoms. The infection is caused by a single-celled protozoan parasite or Trichomonas vagina. So for women, the most common site of infection is the vagina, while for men is the urethra or the urine canal. Transmission may occur either by the penis to vagina, sexual intercourse, or vulva to vulva contact, while women may be infected either male or female sexual partner. So men nearly always become infected from having sex with women or not men. So a woman with trichomoniasis is more likely to become HIV infected if she exposed to the virus. So a woman with trichomoniasis is likely to pass the HIV virus onto other sexual partners. So here are the signs and symptoms of trichomoniasis include the vaginal odor, vaginal discharge, pain or discomfort during sexual intercourse, and pain when urinating.
Good day, Mom. So today I am assigned to report on the prevention of sexually transmitted disease and infection, which is the STD and STI. So STD and STI typically occur through sexual intercourse between two individuals. However, they are not solely transmitted through sex. They can also spread through physical contact with infected skin and by sharing personal items with an infected person. So to prevent STD and STI, practicing safe sex is essential of they are one of the most effective method of using new latex condom or new condom every time, as using an old one increase the risk of infection. So condoms should be used for oral, vaginal, and anal sex. So additionally, when using latex condoms, it is crucial to avoid um, using oil lubricant base such as petroleum jelly, cause oil lubricant base can degrade the latex, leading to the condom breakage and increasing the risk of STD and STI transmission. It is also important to note the non-barrier forms of contraception, such as oral contraceptives or intrauterine devices or IUDs. Do not protect against this non-barrier of contraception is has no use or it cannot protect you against STD and STI. While these methods are effective for preventing pregnancy and they do not prevent the transmission of infection. Here are the methods for preventing STD and STI. We have first, abstain. So abstaining from any sexual activity is the most effective way to avoid contracting an STD. Practicing self-control is one of the very important, and choosing to abstain can significantly reduce the risk. While sexual activity is a natural part of relationship, in individuals must make informed decision to protect their health. So the second one is being faithful to one unaffected partner. It is also considered as one of the prevention having STD. So engaging in a long-term monogamous relationship with a partner who is free from STD or STI can help prevent infection. So many people are unaware of STD, so ensuring that both partners are tested and committed to each other is an important preventive measure. So the third one is vaccination. So certain vaccination can protect against STD that may lead to serious health complications such as HPV and hepatitis B. So HPV are also known as human papillomavirus. There are vaccine of these HPVs. It helps to prevent infection that can lead to cervical cancer and other health issues. So HPV often has no symptoms but can cause abnormal cell growth in the cervix. Next is a hepatitis B vaccine. So it prevents infection from hepatitis B, which is transmitted through infected blood, semen, and bodily fluids. So hepatitis B can cause liver inflammation and serious liver damage, and it is not curable. Getting vaccinated is a crucial step in protecting yourself. So the fourth one is getting tested before engaging in a sexual activity with a new partner. So before having intercourse with a new partner, both individuals should undergo STD testing to ensure they are infection-free. Open communication about sexual health is the key of preventing
the spread of infection. The fifth one is drinking alcohol in moderation and avoiding recreational drugs. So, alcohol and drug use can impair judgment, leading to risky sexual behavior. So, misuse of these substances can result in unprotected sex. So, increasing the likelihood of STD transmission, you should be responsible in drinking and avoiding drugs use are essential for making informed decision about sexual health. This is the sixth, the second to the last, prevention of having STD or getting STD. It is the communicating about safe sex or communicating with your partner before engaging into sexual activities. So, discussing safe sex practices with your partner is crucial. If you prefer to practice safe sex, it is important to communicate your concern clearly. If a partner does not respect your decision, you should reconsider the relationship. A partner who truly cares for you will prioritize your health and well-being. So the last one is considered as one of the most important prevention of getting STD is the education and awareness for everyone. So education plays a vital role in STD prevention. There are increasingly concern about teenage pregnancy and a lack of awareness regarding STD. So parents, schools, and society must educate young people about safe sex practices and STD prevention. Additionally, sexual education programs should be inclusive and provide information relevant to the LGBTQ or the lesbian, gay, bisexual, transgender, queer plus questions community, ensuring that everyone understands how to protect themselves from the infection. In the conclusion of prevention, STD prevention requires awareness, education, and responsible decision making. By practicing safe sex and getting vaccinated, staying faithful, and undergoing regular testing, individual can significantly reduce the risk of contracting infection, and it is essential to prioritize the sexual health to maintain a safe sex healthy lifestyle. That's all. Thank you.